It's almost like, hello. Can they hear us?
Yes,
Yeah.
Good.
yes, yes. Hello, hello, hello. I want to thank you for joining us. We're scheduled to start at 6 o'clock, which it just turned 6 o'clock, but it looks like we've got some more registrants who are still logging in. So we're going to wait another minute or two while they connect before we get started. But I want to say hello to everyone who's joined us thus far.
Mhm.
Super excited to have you with us.
And Tammy, they can write questions, can they, in the chat or something?
We have a Q&A section at the bottom of the screen.
Green. Got it. Mhm.
Mhm. Hello again. I want to welcome everyone who is joining us. We're going to get started here in just a minute, but we want to welcome you, and we're super excited to have you joining us this evening. It looks like there's a few more people that are logging in. So we'll give you all a minute or two to connect
This
before we
is,
get started.
oh,
Hopefully, everyone has had a pleasant day thus far and have enjoyed this day we're having. Sun was out for the most part, but a little cool. But here we are in this evening, and we're super excited to have you. All right, so it looks like most people have connected at this point. We're going to go ahead and get started. If anyone else comes in, they can definitely connect with us because the doors are definitely open. So I want to say hello and welcome to today's webinar. My name is Tammy Trainer, the Assistant Director of Admissions here at Massachusetts College of Pharmacy and Health Sciences. And here with me, I have Francis Keach and Keith Hurst. Dr. Francis Keach is the Dean of School of Medical Imaging and Therapeutics. Keith Hurst is the Associate Professor, Program Director of Respiratory Therapy, School of Medical Imaging and Therapeutics. I'm going to turn it over to them to introduce themselves. We'll start with you, Francis.
mhm. Thank you very much, Tammy. As Tammy sort of mentioned, I am the Dean of the School of Medical Imaging and Therapeutics. I have been the Dean since the 2018, in fact, and I've been at the university since 2000. Prior to that, I was a nuclear medicine technologist, the chief tech actually at the Dana-Farber Cancer Institute. And prior to that, I was actually at Mass General doing primarily research in sort of nuclear medicine. My background, of course, is medical imaging, but have worked very long hours with Keith and the team that we have in developing this particular program. I'd now like to actually have Professor Hurst actually introduce himself as well.
Thank you, Dr. Keith. So my name is Keith Hurst. I'm a respiratory therapist. Yeah, I'm starting to approach almost 30 years of being in the field. Um, so I've kind of worked all aspects of respiratory. I've done neonatal pediatrics, which is really my specialty. I've always loved working with the neops, but I've done adult. I've done critical care transport. I've done management, and obviously I'm done education. I've been in the back associates, baccalaureate, entry into practice, and kind of now turned my attention into the degree advancement aspect of respiratory. So I've been here for about 2 years, but I've been involved with the actual program from its get-go. I was one of the original founding advisory members, so I've really been um, part of this program as we built it literally from the ground up with some guidance from um, Dr. Bob Kazmarek, who's kind of instrumental in trying to get this running. And if you know Bob Kazmarek, he's a legend within respiratory and worked at Mass General until his passing a couple of years ago. But he actually reached out to me and brought me in to help as we started to form the foundation of this particular program. So thank you.
Thank you. Thank you. Thank you very much. All right. And I've been having some technical difficulties, but you all can see the slide presentation, correct?
No, we're just seeing you.
Oh, I can see the slides, actually.
Hold on. Yeah, switch.
How about everybody else? If you want to just maybe put up your hand if you can, or
Right. Or thumbs up or thumbs down if you can see the presentation.
okay, we've got one hand.
Okay,
Okay.
cool.
All right. What about now, Keith? Can you
Yeah, I
see?
can. I had to switch screen. Sorry. That's why. So we're good.
We're good. All right. Let's get started. All right. So this is our agenda for today's webinar. First, I want to thank you for those introductions, and we're pleased to be here today to present our university's offerings through the School of Medical Imaging and Therapeutics. During this webinar, we will discuss information about our college, the online experience, the Bachelor of Science in Respiratory Therapy program, the curriculum, how to apply, and we'll end with the Q&A to cover any additional questions you might have. So at the bottom of the screen, you'll see a box that says Q&A. Any questions that you have throughout the webinar, please place those questions in the Q&A section, and we'll be sure to address those before the presentation is over. Also, keep in mind that this webinar will be recorded. So if you miss anything or need to log out before the ending, not to worry. The recording will be sent to anyone who registered to attend today's webinar. Okay, let's get started. Okay, I'm going to turn things over to Keith right now, if he can explain to us a little bit about what this slide is saying.
Helps if I'm unmuted. So thank you, Tammy. So yeah, really, this is our mission and our mission statement. And so the Bachelor's of Science in Respiratory Therapy BSRT degree completion program will prepare respiratory therapists with an Associates of Science degree to advance clinical and professional practice through an interdisciplinary curriculum that incorporates research, critical analysis, and evidence-based approaches. So that's really our mission for the program.
Okay. Okay,
Um,
talk to us about accreditation.
Sure. So unlike everyone here, or I'm assuming everyone here has gone through an entry into practice program, which is required to be accredited by COARC, the Commission on Accreditation for Respiratory Care. Degree advancement programs we're not required to be accredited by COARC. It's actually an optional um, or voluntary accreditation. That being said, we are seeking accreditation. In fact, just to let you know where we are, in early December, we had our virtual site visit, and we are on the docket to be voted on at the July meeting of COARC's board of directors. So we're pretty much there. But because we are seeking CORC accreditation, we have to have the statement up there that basically states that the Mass College of Pharmacy Bachelor's of Respiratory Science Respiratory Therapy degree completion program is in the process of seeking CORC accreditation for the program, and Mass College can make no assurances that accreditation will be granted by COARC. And that CORC utilizes a programmatic outcome-based to look at performance indicators to determine how well the programs are doing. So while it is optional, again, we have decided that we want to move forward with this. And the rationale for that is because then we are held to the same standard as all the other programs. So we are held to the same standard as Boise State, as UNC, as all the other COARC approved respiratory programs out there. Okay, next slide. Okay. So why do you want to get your BSRT? So, first of all, the ARC has noted that the BSRT is the preferred entry into the profession. Obviously, you all have your associates. You do not have your BSRT, but we want to help you get into that. So one of the things that AARC is really pushing on, as well as COARC, is to have more of these degree advancement programs around. And so why the need for the baccalaureate degree? Well, the clinical work has become a lot more technically complex, and there's a lot more stuff that therapists need to know to work at the bedside and to maintain and provide good outcomes. There's more of a need for non-technical skills, and that means not just going and pushing it now, but how do you assess for the current evidence base to determine that you're delivering the appropriate therapy? And there's also now a greater demand for respiratory care at alternative sites, which do require a baccalaureate or higher. And lastly, and this was a validated study that came out 2 years ago, 2023, that patients who receive care from someone that has received their baccalaureate actually had improved outcomes. So, we always want the best for our patients. We want improved outcomes. And there's now a study that validates that therapists that have their BSRT actually provide better outcomes than a therapist that only has their associate degree. There's also a career advancement opportunity. So if you want to get into education, for example, and you want to, maybe in a couple of years be in my position where you're going to need your master's, well, the next logical step is to get your baccalaureate degree. If you want to get into management or leadership, they're going to require at least a bachelor's, if not a master's. And again, this would be a nice stepping stone to that. There is now the potential of the APRT program. And granted, there's only one right there, but they're going to require you to have your bachelor's as well. And there's also a link to the increased salary potential as well. If you do get your bachelor's, you will make your money back and you will have a higher income. Next slide. So speaking of salary potentials, as healthcare is a really fantastic field to be in. We've seen our wages kind of go up over time. U.S. World News Report has said healthcare is one of the largest employers in the U.S., and respiratory therapy is ranked number 20 in the healthcare industry, according to that report. Typically, average salary for respiratory therapists was a bachelor's degree. According to salary.com in 2022, is about $84,000 a year. Mass College has been ranked the third best institution for economic value for students. So that means your return on investment is very strong, because we do know that coming back to school is an investment in both your time as well as your money. And based on the outlook and the quality of the education that we provide, we do believe it'll be a good resource or investment for your resources.
Okay. All right. Thank you, Keith. So also, did you know, to add on to that more from a university standpoint, that MCPHS is a healthcare specific university offering 100 programs in different health science fields. The university has been around for a long time, and we have actually celebrated 200 years of existence. We started as just a pharmacy program in Boston, and MCPHS has grown to incorporate over 7,500 diverse students between our 3 campuses, Boston, Worcester, and Manchester, New Hampshire, and our online branch, which we are focusing on tonight. We are also proud to be a teaching university, and healthcare is our specialty. 91% of our faculty are still working in the healthcare field while also teaching. So they are well versed in the course material and are constantly staying up to date on the current healthcare system. As Keith mentioned, we realize that returning to school will be an investment of both time and money. But based on the current job outlook and quality of education MCPHS can provide, we do believe MCPHS is an excellent choice with a strong return of investment, with recent acknowledgement for being in the top 5 for most transformative colleges in the United States. Also earned top rankings for highest paid bachelor's degree for allied health professional graduates in the New England region. So, talking about online at MCPHS, we introduced our online branch in 2011, and now we offer over 35 online programs here at MCPHS and have over 500 total students studying with us online nationwide. Our online programs are flexible, giving you the freedom to continue working and living your life while going to school. And although the programs may be online, our students have access to the same resources as our on campus students do. You have access to faculty advisors, tutoring, or CASE, which is an acronym for Center for Academic Success and Enrichment, as we refer to here, career services, our online library, counseling services, networking, which I highly recommend to tap into our global network of over 32,000 alumni. So definitely worth looking into. And now I'm going to kick things back over to Keith.
Great, thank you. So as I mentioned, we are seeking accreditation. Again, with that holds us to a very higher standard, and we also want to make sure that our outcomes are aligned with COARC, and so hopefully we'll have good news on that um, going forward. So the program can be done full time or part time, though being very frank with you, the only way you're going to do full time is if you're not working. So most of the students enrolled in the program do it part time. So you can take 1 to 3 courses a semester. If you're to do three courses a semester, you'll finish in a little over a year. If you do 1 course a semester, you'll finish in about 3 years. Most do 2, so you finish in a little less than 2 years. Um, in terms of our start date, we have three times you can start. We accept students in this fall, spring, and summer. So right now, a little tight, but we can get you in for a summer start if you wanted to, but definitely can get you in for a fall start. Total credit is 36 hours, and we accept up to 60 students per year.
Okay.
With regarding the online experience with this program, so all of our courses are what we call asynchronous. And what that means is um, we don't have scheduled class time. So it's not like I have to find time on a Tuesday from 10 to 12 to show up for a lecture. All the content is posted at the beginning of the week, and then throughout the week, stuff is due. Mostly discussion boards or assignments are due throughout the week. So a professor may hold an optional meeting if they want to go over a particular course of assignment. But again, that's not required for anyone to attend. Um, so that makes it very flexible for the working student. We use Blackboard as our learning management system. So if you're familiar with Blackboard, that's the same thing. If you use any of the others, it's very similar. Blackboard is just another learning management system. Um, and just in terms of the expectation, you can expect to spend about 3 hours per credit each week on coursework. So if you take a 3 credit course, you're going to be expected to work about 6 to 9 hours on that particular course. you're taking two courses, you can double it. So you're talking 12 to 18 hours a week that you're going to need to put into coursework. And that means, and what does that mean? That means you're reading materials, whether that is articles or chapters from a book, listening to a pre-recorded lecture, and then taking time to post on a discussion board, and potentially working on assignments that are assigned by the instructors throughout the semester. Uh, most of the uh, assignments are project based, so there's not a lot of exams and quizzes. Some courses may have some quizzes, but they're not the high stake quizzes that you're probably used or tests that you were used to when you were getting your respiratory. Because again, they were trying to prepare you to take a board exam. Um, Ours is a little bit different, is we're trying to prepare you to take what your knowledge and apply it to the respiratory world. So a lot of the projects and papers that you're going to have to do are can be used in real life. So an example is you might be asked to uh, come up with a research proposal, and again, that's something you could do once you graduate. You can then take that proposal and actually follow it through. So a lot of these projects and assignments that we have you do, we try to make them as authentic and practical as possible. So it's not just doing it for the sake of doing it. Um, and then lastly, in order to finalize, or the last course you'll take is a capstone course, which is just really a summation course. And you'll have a capstone project where you'll be expected to kind of integrate a lot of things that you learn throughout your online learning experience.
So, Keith, let me ask you a question. What
Mhm.
would a typical weekly schedule look like for students online?
Yeah. So a typical week is Monday morning when you wake up, or late Sunday night, depending on if you work the overnight shift. But at some point, by 8 o'clock Monday, you'll have new content for the week that will be posted. You'll have objectives that will be asked for the week. You'll have uh, some reading, whether that's through a chapters in a textbook or articles. There'll be a recorded PowerPoint lecture, which you'll be encouraged to view and listen to. Um, and then usually by midweek, so Wednesday or Thursday, again, depending on the instructor, you'll have one or maybe two Blackboard discussion posts that you'll have to initially post for. Um, and then the expectation is by that Sunday, end of day Sunday, that you would have responded to an appropriate number of courses. Again, that's up to the instructor. So the typical it's you have to respond to um, two other students within your class on a particular topic. And also typically do on Sundays might be any assignments. Again, the assignments may be given to you like 2, 3 weeks ahead of time, so you've got time to work on them, but they usually do. So you'll have time to work on them. If you have questions, meet with the instructor to get clarification, and then finally submit in on that whenever by the due date.
Okay, excellent. And then you may have mentioned this earlier, but does each class have a midterm and final?
Uh, No, like I said, we're mostly project-based outcomes. So, there are really no midterms and finals. Again, there's a couple courses that have some quizzes kind of built in, but it's just more to keep students, kind of like a check-in type of deal. It's not, like the total number of the quizzes might be worth like 5% of your grade, so very low impact. Um, and there's no like big final exam that you would have to do or anything like that.
Okay, thank you, Keith.
So the program curriculum, trying to dive into this a little bit more. So you need 120 credits to obtain your baccalaureate degree. Um, Most associate programs give you approximately 72 credits. If you graduate with less than 72, or So between 64 and 72, you might need to take some additional courses. But based on that 72, we give you 12 credits for your RRT credential. And then you'll take 36 credits through the program here. And you add those up in the 72, the 12, and the 36, and that gets you your 120. I just want to make a note. If you're wondering why do we require the RRT credential, that is because we are, as I said, we are seeking COARC accreditation, and one of the COARC standards is that graduates from a degree advancement program have to have their RRT prior to graduation. It's up to the program whether we can allow someone with a CRT in, and then at some point they have to have their RRT. We have decided as a program that any applicant must have their RRT credential prior to starting the program. That way we don't have to worry about, someone getting ready to graduate and only have their CRT.
Okay.
And then next slide. Okay, so what does your curriculum look like? What are the courses? So you start off with RES 405, which is an introduction to respiratory care studies. And in this course, we're really going to give you the foundation or the scaffolding to really begin the program. We'll go over a lot of things. We'll talk about plagiarism. We'll talk about how to create a good discussion post, where to do some research, how to get articles, things like that. We'll talk about plagiarism, things like that. We'll talk, some research. We'll talk some evidence-based guidelines. We'll talk about leadership and education. So kind of a little smattering of everything, but that really kind of kicks it off. And that is the course that you'll all come in and take. From there, it kind of depends what semester you start as to what courses you take, but there is a sequence that we do have depending on when you start. So if you start in the summer, the fall, or the spring, we have a certain course sequence. But they all start with RES 405, and they all end with RES 490, which is the respiratory capstone course. And that is the summation course. You have to take all these. You're required to take some of these courses in order, before you can take and earn, before you can sit for other courses. There are 2 courses that Mass College requires. These are non-respiratory courses, and these courses can be transferred in if you have taken them in your associate program. One is LAB 220, which is Intro to Interpersonal Communication for Healthcare Professionals. Really, we're looking for some sort of communication course. May not be specifically, communication for healthcare professionals. And the other one is LIB 512, which is healthcare ethics. So if you've taken kind of bioethics, healthcare ethics in your associate program or a communication course, you'd be able to transfer them. Just to note, this is not an English course. This is really a communication course. If you took I took English 101 and English 102, wouldn't that transfer in? No, this is really like a communication course. There are also 2 electives that you can choose from. So you take 10 courses, you have to take an elective. So right now there's 3 options for electives. You can take a respiratory elective. One is RES 460, which is Essentials of ECLS. And or you can do the respiratory care internship or respiratory care practicum, and I'll talk more about that on the next slide. And then you could take a Mass College elective, and those are courses that are offered kind of throughout the year. Again, online 3-credit courses, and you'd have to get approval by me before you could take them. But usually there's a number of courses that you could take. Just to note, there are some in the fall, or hopefully by the fall, we're going to be offering some additional elective courses, but that is more to come.
Okay, and Keith, I have a question for you. If I'm currently enrolled in a BSRT and I want to transfer into MCPHS, are there opportunities for transfer credits, or is it just the two courses that you mentioned?
So unfortunately, it's probably just these two courses that the Lib 220 and the Lib 512. And that's because in order for you to get your degree from Mass College, you have to have what's called a residency requirement, which means you have to have taken so many courses through Mass College in order to be get the degree from Mass College.
Okay.
Yeah. The practicum, so I want to talk a little bit about this. This is kind of unique to our program. And this is a 3 credit elective. And again, this is the ability for you to gain additional exposure or training in an area that you would like to work in. Now, if you remember when you did your got your associate in respiratory, it very clearly states in core guidelines that if you want to work as a student, you can't use that as clinical time, right? Well, guess what? Now you can. So you actually have the opportunity that if you were going to get trained in another area within your hospital, okay, that you could actually use that as a practicum. So I'll give you an example. Okay, let's say you're working at a hospital that has ECMO and you've been there for a year. They say, hey, we want to have you train for ECMO. You could come to me and say, hey, I'm being allowed to train for ECMO, and we can use that as your practicum, which would be your respiratory elective. Okay. Now there's some things we'd have to work out. It's not as easy as like, oh yeah, I'm doing ECMO training and whatever. We have to set some stuff up. There has to be some expectations that are done, but that's kind of the example I'd like to use. So um, if you worked in the adult ICU, you want to get trained for the NICU PICU is another thing. If you want to do a leader management practicum or an education practicum, we can work with you on that. The big thing is you have to have some sort of tangible result of the completion of the internship, whether that's a certificate or a project or something like that. And it has to be about 45 hours over the course of the semester. You're like, oh my God, that seems like a lot. How am I ever going to do that? Well, I'll just throw this out for you. Most ECMO training courses, right? First of all, just the didactic and lab portion is probably about 40 hours. It's usually about a week long, 32, 36 hours or so, or maybe even 40. And then you've got 120 hours of sitting time that you have to do before you can be allowed to be out on your own. Well, that's 100. So by the time you think about it, you know, you're well over that 45 hours for that. So it actually adds up very quickly. If you were to get trained in the NICU and PICU, let's say that's a 3 week orientation. You work 36 hours. Well, 3 times 36, you exceed 45 hours right there. So it's not unrealistic that what we're asking on this. And next slide.
Right.
That
So
actually is, oh, thank you, Tammy. That is me. I can talk about what program outcomes. One of the things that our advisory board did with Keith was determine what our objectives would be for the program and what the students at the end of the program, our graduates, would complete and have as their learning outcomes. These are expected student learning outcomes for the entire program, and it's part of our accreditation as well requirements. All of our courses have been mapped to these particular learning outcomes, and each course adds a little bit to some of them or a little bit to particular ones. The first learning outcome is to demonstrate an understanding of education theories, curriculum development, assessment strategies, and instructional design in the healthcare environment. The second learning outcome to demonstrate an understanding of leadership and management strategies in the healthcare environment. The third, utilize professionalism and communication skills to promote advancement in the profession. And the fourth and final one is to analyze research on an advanced level for evidence-based practice and theory. Thank you.
thank you. So when talking about the admission requirements, what is needed to apply to our program? So number one, an associate degree in respiratory therapy from a COARC approved program, which is the Commission of Accreditation on Respiratory Care. Number two, a current RRT, which is Registered Respiratory Therapist, credential from the NBRC, which is the National Board of Respiratory Care. Number three, proof of a current state licensure. So with all of these documents, it will be easy to apply. Note at the bottom, minimum of 64 credits. Additional courses may be required to reach 74. And that's what Keith had alluded to in our previous slide. So for application for admission, to apply, go to our website, MCPHS, and search our program, Respiratory Therapy BS, and simply click the red apply button and complete what's called a transfer application. You will also need all official transcripts from all colleges and universities attended. So yes, even if you took one course at a community college, we will need that official transcript. They can be sent electronically to admissions.online@mcphs.edu or by mail to MCPHS Admissions Office, 179 Longwood Avenue, Boston, at 02115. So either Keith or Francis can answer this for me. Do students need to take the GRE or any other exams for this particular program?
Nope, you don't.
No.
You don't need your GRE, SATs, or anything like that. Like I said, the only test you need to have taken is which is the one you need to take the RRT credential or earn the RRT credential.
All right, excellent. And the application is free, by the way. So it is a free application. Personal essays, resumes, or letters of recommendation are not required, but you are welcome to send them along if you would like to do that. Again, the only criteria needed to apply and be accepted are completing the MCPHS online application, sending in all your transcripts, and having the current RRT credential from the National Board of Respiratory Care. So for admission details, again, as I mentioned, it is free to apply. We have rolling admissions. So after you apply, it only takes about 1 to 2 weeks to hear back from the admissions committee. Deadlines for the 3 starting program dates are listed on the slide. So for fall, we have an August 1st deadline with a start date of September 3rd. Spring with a December 1st deadline with a start date of January 13th. And summer with an April 1st deadline with a start date of May 19th.
Tammy, just with the summer one, if someone were to apply and get all their information in within, let's say, the next week or two, can we, and they want to start in the summer, is that still doable?
That is still doable. Absolutely. It is still doable. It's a tight window right now because we're in April 2nd, but it's definitely doable. So all right, so the tuition and financial aid. The tuition is currently $885 per credit hour. Fees are not included in that. So when you do the math for a 3 credit course, it's about $2,655. For the 12 courses, you have about $31,860. Financial aid is something that you can definitely apply for. with the FAFSA, which is the free application for federal student aid. All domestic students with valid FAFSA on file would be considered for federal aid. Our financial counselor, her name is Kristen. And so she would be your contact to discuss all things related to funding, whether it's payment options, your FAFSA results, things of that nature. Now, I see at the bottom something about employee tuition reimbursement / external scholarships. Is that something that either of you can touch on
Yep.
real quick?
Yep. So Mass College, the programs are usually acceptable for uh, employee tuition reimbursement. Again, you'd have to check with your specific employer as to whether or not you could get tuition reimbursement. But typically, the courses would go. You could be used to apply for tuition reimbursement. And then there's other external scholarships that are available for students that are in a degree advancement program that you could apply to and get. Just one quick note for financial aid. If you're looking to do financial aid, you have to be taking a minimum of 2 courses a semester. If you're only taking 1 course a semester, you're not eligible for financial aid. So you have to be taking 2 courses a semester in order to get financial aid.
Good point. Thank you for bringing that up, Keith. As we all know, funding is an important piece to take into consideration when looking for a program, but do not let it scare you. Remember, this is an investment in your future self and career. As we mentioned in the previous slides, MCPHS is actually ranked number 3 in the entire nation for return on investment, which just goes to show you that our students are doing very well for themselves post-graduation. We have one of the lowest loan default rates in the nation, which is very encouraging. So as you navigate this process and have questions, do not hesitate to reach out. As I mentioned before, our Student Financial Service Department is just a phone call away or an email away. You can schedule an appointment with Kristen. She'll be more than happy to talk with you one-on-one about your financial services. And as you can see, her information is listed on the screen. But if you need more information on how to contact her, please let me know and I'll be more than happy to point you in that direction. Now it is time for any questions that you may have. Okay, I'm opening up the Q&A section and I don't see any questions posted yet. So that must mean we did an exemplary job of of giving out the information. Any questions? Now is definitely the time. Well, I mean, if there aren't any questions, this will conclude our webinar tonight. And I want to thank you, everyone, for attending. We have included our contact information on the next slide here. So please reach out if you have any further questions about our program, about what you heard tonight. We really appreciate your time today, and we hope that this was helpful as you plan your educational journey. We look forward to hearing from you, and we thank you for spending time with us this evening.
Thank you very much from the two of us.
Thank you.
Thank you, Tammy. Thank you, Keith. We'll talk to you soon.
Yes, thank you, Keith. Thank you, Francis, for your time today. We really appreciate it. It looks like there's still a participant. If you have a question, we're definitely still here.
Oh, he left.
He left. Just left.
Scared him off.
They started to drop off gradually.
Yeah.
You know, we have so few. Tammy, I'm wondering whether we should do this more